I am proud to announce that Desert Recovery Centers is the full continuum of care. We now have the ability to treat you from inpatient to PHP to IOP to OP to telehealth to peer support, all the way through your journey. And what's most important about Desert Recovery Centers is we're clinically led, but we're peer support driven, right? And so the clinical team leads us, and the BHTs and the peer supports, they drive it home. Right now, I'm also proud to announce that we're the only company in the nation that has 30 hours of clinical group led by professionals. 30 hours, 6 hours, 7 days a week. We're having clinical group, and we're actually able to utilize the professionals. We're working out of a workbook at Desert Recovery Centers that has CBT, DBT. We update the workbook that's individualized for you because everybody's treatment plan is different. Different target goals, different diagnoses, different outcomes, different SMART goals, and it's updated every 6 days with our entire leadership team. We have 5 licensed clinical psychologists, Dr. Snell, Dr. Ellis, Dr. Day, Dr. Shelton, and we're led by the most amazing Dr. Wynn. And through that process, we've coupled another 10 professionals that my BHTs do not facilitate groups anymore. Their job now is to connect with the clients on the peer support level because we know exactly how they feel. And through that process, we stabilize them in the first 30 days in residential. From that 30 days, we transfer them over to our outpatient clinic, which is in a commercial space. And in that commercial space, we have some housing associated with it so we can make sure you're living in a safe environment, you're practicing tools when you're not at the clinic, and then we're transporting you to the clinic. PHP is a 45-day program. It's 5 hours at the clinic, Monday through Friday, where it's a 5-hour block. We're getting busy with group programming, individualized. We're also having the one-on-one sessions. Currently at Desert Recovery Centers in our 30-day inpatient program, the average is 4 individual sessions, guys, 4 a week. That's unheard of. You couple 30 hours of clinical group with 4 individual sessions a week, every 6 days updating it, it's about outcomes. We want your stay at Desert Recovery Centers to be your last time in treatment. It doesn't have to be a relapse, and that's what's so important, is having that full continuum of care. So now going into outpatient and IOP and OP and telehealth at the clinic after PHP now gives us the ability to have you there for 3 hours, 5 days a week, then to 3, then to 2 days a week, and then to telehealth to keep engaged with you. Now we have the full continuum of care to be able to practice the tools that we're giving you and reintegrate you into society successfully. Being able to rewire your brain, practice these tools for 90 plus to 120 days gives you the best ability to have the outcomes. There's never enough time in treatment, guys. I'll tell you that right now. I was in active addiction for 20 years. If 90 days in treatment, the math doesn't check out. So at Desert, we want to be there. My team are advocates for the clients. That's what we do. We advocate for you through our documentation at the highest level to give you the most days, the best outcomes, and the best quality of care. Not only do we have the 30 hours of clinical group, we're also going to have 4 one-on-one sessions at the IOP clinic, 4 in residential, but we also offer many ancillary services from soft wave therapy to neurofeedback, to breath work, to yoga, to massages. We do sound healing. We do recovery boxing. That's every single week, coupled with 6 hours of clinical led group every single week. We are a program facility and we're really about it. And it's not the nice house in the 8,000 square foot mansions and the gyms and the massage rooms and the walking path and the frisbee golf and the cold plunge and the pools and the spas and the putting greens and the basketball courts. That's not what makes us us. It's what happens inside that facility. It's the heart of my team. They're all personal and we care, and you're gonna feel it and you're gonna see it the minute you come in. But there's never enough time in treatment, full continuum of care, detox, residential, PHP, IOP, OP, telehealth. Desert Recovery Centers does it all. We have a path for you. Pick up the phone, give us a call. Let's get you going. Let's get you started. You don't have to feel the way you feel anymore. I built a program that has outcomes. The alumni is off the chains. We're graduating at a high rate because we have a true program. So please remember, no matter what program you go to, listen to the staff members, coordinate care to all levels of care. Going through all levels of care is going to give you the best chance for success. And that's what this is about. Because stopping isn't the problem. It's staying stopped and wanting to stay stopped. And at Desert Recovery Centers, we're going to give you your life back.